السلام عليكم ورحمة الله وبركاته. معك الطالب ريان عبد الله المطرف. واليوم بشرح محاضرة الثرومبوسيس. فبسم الله نبدأ. فبكل اختصار هذه lecture outlines اللي بنتكلم عنها اليوم هي mechanism of thrombosis أولا، ثانيا الفرق بين arterial venous thrombosis، بعدين نتكلم تحديدا عن DVT and pulmonary embolism، وبعدين the prophylaxis and treatment راح نمر عليها بسرعة because it is covered extensively in the pharmacology lectures. فبسم الله. thromboembolic disease. نبي نعرف أول شيء وش الثرومبوسيس والأمبوليزم، وهذا الشيء تغطى في pathology lectures في second year لكن نغطيه بسرعة. طبعا thrombosis is an inappropriate or adverse intravascular, so an inappropriate amount of blood clot formation which causes an occlusion of the vessel. فعندي vessel inappropriate amount of platelets or blood clot formation فيصير لي occlusion. متى يسمى embolism؟ when this occlusion is ruptured or travels through the body. when it is called an embolus, when a thrombus breaks, it becomes an embolus. عشان كذا a pulmonary embolism is called a pulmonary embolism because it travels into the lungs وغيرها. So sudden obstruction of artery which breaks free from the initial site of thrombus formation travels in the bloodstream or to a downstream site. Basically الامبوليزم يسافر حول الجسم والثرومبوسيس قاعد في مكانه باختصار يعني. طيب mechanism thrombosis. كيف يصير لي أنا thrombosis أصلا من البداية؟ عندي شيء اسمه virtuous triad which is the three things or three mechanisms that will cause a thrombosis that need to happen to cause a thrombosis. So أول شيء عندي damage to the vessel wall. There has to be any damage to the actual vessel wall. بعد الدامج راح تلقائي راح يصير لي stasis أو any alteration of the blood flow which will help in the formation of a thrombosis or thrombus. بعدين any alteration of the blood components ونتكلم عنها بالتفصيل وش يعني alteration هذا برضو راح يساعد which is the last step يعني into forming a thrombus. stasis as you said is a stoppage of blood. فالدم لما يقعد في مكان واحد فترة طويلة يسمى stasis. طبعا هذا يزود risk of forming a thrombosis. طيب وش يعني damage to the vessel wall? How does that happen? We have an example that we've covered before in the CVS module and هو atherosclerosis. So when you have a plaque and the plaque builds up and it ruptures, this rupture will it will reveal the subendothelial layer, and this subendothelial will release the tissue factor. Tissue factor, as we've seen in the previous lectures, what will tissue factor do? It will increase the thrombin formation and clot formation. فهذا راح يزود لي platelet و clot formation و thrombus. حلوين؟ vasculitis, inflammation of the blood vessels, and the immune and non-immune causes. It will damage large vessels, arterioles, venules, causing the platelet and microthrombi occlusion. So this is another way that damage to the vessel wall can happen, which leads to occlusion. MI, something we've talked about a lot. Full thickness infarction also. The damage to the endocardial layer will release tissue factor وهذا راح يسبب لي pleural thrombus. So this is three examples يعني. بالنسبة للstasis, as we said, is the pooling or the stoppage of blood. How can it happen? عندك 4 ways يعني examples. عندك atrial fibrillation. How does stasis happen in atrial fibrillation? Atrial fibrillation is the asynchronic contraction. The atrium يعني في asynchronic ما ينقبضون مع بعض, so they will not pump يعني in a synchronized manner. فهذه المشكلة في asynchronic contraction راح يسبب لي pooling of the blood in the atria. فالبولينج هذا البلد لما يقعد فترة طويلة في الاتريا راح يزود لي ريسك ثرومبس. dilated cardiomyopathy لما يكون عندي systolic dysfunction مثلا في ventricles برضو يكون في عندي pooling في البلد في ventricles ما عندي systolic dysfunction العضلة وبقادرة يعني تنقبض يعني pressure الكافي إنه يودي الدم للarteries فسبب لي pooling blood و thrombus. Prosthetic heart valves also could cause stasis which could lead to thrombus. Immobility لما patient يكون bedridden for a long time after surgery مثلا, this could cause a DVT because of the stasis. Extrinsic compression, maybe if a patient has a mass or tumor that could cause the stasis also could be increase the risk of a thrombus. So that's another way that stasis can happen. بالنسبة blood components, this is the alteration. احنا قلنا alteration of blood components. What does that mean يعني؟ وش alteration في وين بالضبط؟ فيقول لك that it's a delicate balance في ميزان جسمنا يحافظ عليه أو في procoagulant و anticoagulant factors. فهذا الميزان لما يكون في alteration، لما يكون في خلل، راح يزود لي الريسك of thrombus, and that is a mechanism of how thrombus happens. طيب وش الخلل وين الخلل يصير؟ فهو يقول لك تحت هنا بكل اختصار أن لما يكون في خلل احنا ما نقول ان الخلل بسبب زيادة production of procoagulants, rather we say ان في خلل defect in the amount of anticoagulants that the body is making, في defect in the amount of anticoagulant proteins. احنا ما نقول ان في زيادة في production of the procoagulants, we say there's a problem in the anticoagulant proteins in the body, there's a defect, inherited disease or such يعني. We don't say overproduction, we say ايش الكلمة impairment in the production of the anticoagulants. So this is the imbalance we're talking about, or the alteration in the natural balance of the body. طيب اللي بعدها هي arterial versus venous thrombus. So we have a the arterial thromboembolism. First, the coronary artery thrombosis. So this is an example. In the coronary artery thrombosis, it is usually due to atherosclerosis. So ruptured plaque formation, possibly platelet clot because of the tissue factor, and then after it develops, could lead to ischemia and even an MI. Carotid or cerebral artery thrombosis could also happen, but is usually the secondary to hypertension and atherosclerosis. And it can cause a transient ischemia attacks, also called as mini strokes. بالنسبة cardiac thromboembolism, we have atrial and ventricular. The atrial thrombus forms in atrial fibrillation and also mitral valve disease. As we said, in atrial fibrillation, there is pooling of the blood in the atria. It is enlarged and cannot contract normally. This will lead to thrombus formation. And نقطة مهمة أن in atrial fibrillation, embolism risk is only increased when you revert to sinus rhythm. ففكروا فيها كذا أن لو في blood في الاتريا، طيب، وفي asynchronous contraction في الاتريا، يعني في atrial fibrillation، في asynchronous contraction، في مشكلة في الرhythm. فأنت لما ترجع الرhythm طبيعي، القلب يعني will pump normally. فهذا يعني أنت غيرته من شوف هو كان في blood في الاتريا وكان ماشي، يعني هو كان في thrombus. فالأمبوليزم ما راح يصير إلا لما ترجع الرhythm للطبيعي، فيرجع الهارت يسوي كونتاكت طبيعي، فالثرومبس هذا راح يصير لي embolism. It will rip off and travel through the body because of the heart going back to its normal contraction. فيقول لك هنا embolism risk only increased when you revert to sinus rhythm. طب إيش الحل؟ أن تعطي anticoagulative. طبعا هذا مو معناه، بس أنا عشان تفهمون، تعطي anticoagulative therapy for 3 weeks. بعدين تعطي cardioversion، سوي له cardioversion to normal sinus rhythm. يعني بهذه الخطوتين تقدر ترجع طبيعي. Ventricular برضو mural thrombus can complicate a full thickness MI and also dilated cardiomyopathy, where the contraction and systolic emptying is impaired, predisposing the blood clot formation. So نفس الشيء بس ventricle pulling of blood in the ventricle because of systolic dysfunction. يعني. An embolism of intraatrial and ventricular thrombi occurs to the systemic circulation. طبعا إذا كان في embolism, it will go to the systemic circulation. It can cause strokes, limb ischemia, splenic, renal, or mesenteric infarction. This is an example of the full thickness thrombus of the left atrium. فالصورة يعني توضح لكم يعني لما يقول لك full thickness, this is what it means. Placental thrombosis could happen, and also it can increase the risk of miscarriage, stillbirth, intrauterine growth retardation because of the impaired circulation. بالنسبة للvenous thromboembolism, the two main examples that are talked about in this lecture are deep vein thrombosis and pulmonary embolism. these two have different manifestation, but they are the same pathogen. They have the same pathogenesis, identical risk factors, and many patients present with symptomatic DVT and silent pulmonary embolism or symptomatic pulmonary embolism with asymptomatic DVT. Usually present together or يعني لهم علاقة ببعض. They're interconnected. Occurs deviant thrombosis, we know, occurs in the lower limb, causes pain, swelling in the lower limb due to the obstruction, and also can be asymptomatic. Could lead to chronic venous insufficiency, and less commonly it's in the upper limb. Like if it's in the upper limb, it's secondary to venous compression at the thoracic outlet and IV cannulation. Rarely, it occurs in the mesenteric or portal or hepatic veins. Like if it happens, this is called as Budd-Chiari syndrome. This is associated with procoagulant blood conditions, مثلا myeloproliferative disorders like polycythemia vera and essential thrombocytosis. When we say essential thrombocytosis, this is because we don't know the cause is unknown, or it's called essential. Can even be called primary, but essential means unknown cause. بالنسبة pulmonary embolism, we know that the clot usually comes from the lower limb in DVT and travels via the inferior vena cava. بعد inferior vena cava بيروح left right atrium to the right ventricle and into the pulmonary arteries. Usually asymptomatic, but can be presenting with acute shortness of breath, presenting with pleuritic chest pain with or without hemoptysis, and hemoptysis will be because of the pulmonary infarction. For the arterioles or the capillaries will hemorrhage and will present with coughing of blood. Collapse could happen إذا كان pulmonary embolism مرة كبير. Could even cause collapse، يعني يسد مجرى الدم مرة واحدة، يعني من كثر إن pulmonary embolism كبير يعني. This could cause collapse. The right ventricular outflow will be obstructed. Sudden death, it is a major cause of hospital mortality and occasionally presents with more chronic signs. Usually not alone. Inherited risk factors for DVT and pulmonary embolism have family history. Factor V lead-in, which we'll talk about in a second. Prothrombin gene mutation, antithrombin deficiency, protein C deficiency, and protein S deficiency. الأشياء اللي تكلمنا عنها فوق. This will tilt the balance of the blood components and will increase the risk. زي ما قلنا, tend to be a defect in anticoagulant proteins which control the thrombin generation, thereby resulting in the increased thrombin generation. فبيزيد لي الثرومبين generation لأن ما عندي شيء يسوي لي inhibit أو يتحكم في البالانس يعني، فراح يزيد لي الريسك. هذه من المحاضرات الماضية. So this is how it works. هذا بنتكلم عن factor 5 lead-in، فبس خليني أشرح هنا. So factor 5 lead-in وش هو؟ إحنا قلنا that is a risk factor for DVT and PE. So factor 5 lead-in is a single base pair mutation. Single base pair mutation in factor 5 at the point where it is cleaved and inactivated by activated protein C. وش معنى اللخبطة هذه؟ So إحنا نشوف هنا when thrombin goes to the thrombomodulin receptor on the endothelial cells, it activates protein C into activated protein C. Activated protein C inactivates factor 8 and inactivates factor 5. جميل؟ إيش المشكلة؟ In factor 5 lead-in, I have in factor 5 a single base pair mutation. This single base pair mutation will actually form kind of immunity from the inactivation. Because of this single base pair mutation, the activated protein C will not be able to inactivate protein or factor 5. فأنا عندي هنا factor 5 عنده single base pair mutation. الactivated protein C بسبة ال single base pair mutation ما راح يسوي لي inactivation of factor 5. فprothrombin will continue to form thrombin because of this mutation. فمهما راح thrombin وسوى هذه الحكاية كلها, سوى لي activation of protein C, factor 5 will continue to form thrombin. فهذا راح يزود لي الثرومبين generation, hence thrombotic tendency. I have heterozygous factor 5 can increase 3 to 5-fold the risk of DVT to pulmonary and embolism. In patients with a likely inherited thrombophilia, have an increase 40% have factor 5 lead-in. Homozygous or heterozygous combined with any other abnormality طبعا increase the risk of DVT and pulmonary embolism. الacquired risk اللي فوق قلنا وش كان inherited risk. بالنسبة للacquired risk could be surgery of trauma. يعني the patient will be bedridden after the surgery of trauma مثلا orthopedic or abdominal. So this bedridden state will increase the risk. Cancer, a master tumor could cause stasis and increase the risk of DVT and pulmonary embolism. Prolonged immobility, hospitalization زي ما قلنا فوق. Previous thrombosis طبعا recurrent patient could present with recurrent thrombosis. A previous thrombosis could increase the risk of the next one. Pregnancy or postpartum, OCPs, HRTs also increase the risk, and age will increase the risk. How do you diagnose it? طيب, clinical diagnosis of DVT is not enough. You need imaging. فبالنسبة للimaging, we use بكل اختصار ultrasound of the lower limb in the case of above knee deep vein thrombosis, and in below knee deep vein thrombosis we use the venogram. ففي حالة above knee DVT ultrasound of the lower limb, below knee DVT أو calf thrombosis venogram. نقطة مهمة إن venogram أصلاً هو imaging diagnostic imaging. The venogram نفسه أصلاً increase the risk of causing thrombosis. That is an important point to understand or to know. How do you diagnose pulmonary embolism? The doctor just said no the names: ventilation perfusion scan or CT pulmonary angiogram. This is the normal coagulation pathway. This is how warfarin acts on the normal coagulation pathway. Warfarin is an oral vitamin K antagonist, and I'm sure we're going to take it in the pharmacology lecture, or we took it. What does warfarin do? It inhibits the vitamin K dependent gamma carboxylation of 4 factors. These 4 factors are factor 2, factor 7, factor 9, and factor 10. اختصرها في the year 1972. Year 1972. 10, 9, 7, and 2. So these 4 factors are going to be inhibited أو يقلل منها warfarin. And by doing this, it will prolong the prothrombin time, as we've known in the previous lectures. And it is important to know that the therapeutic range, the INR therapeutic range is 2 to 3. وراح ينعاد علينا كثير في السلايدات الجاية. You have to monitor the INR لأن أنت بتوصل therapeutic range، لأن هذا الرينج مهم. هذا الرينج is the range where is the least risk of thrombotic tendency to happen. فإحنا بنوصل هذا الرينج. Drug interactions could happen because this drug is related to the cytochrome P450, so any inducer or inhibitor of cytochrome P450 will affect warfarin. طبعا it is a teratogenic drug. You do not give it to the pregnant women patients. It is reversible by vitamin K. بالنسبة له heparin, you have unfractionated heparin and low molecular weight heparin. بالنسبة ل unfractionated heparin, what does it do? It basically inhibits or inactivates 2 things: factor 10 thrombin. فهذا unfractionated heparin. factor 10 و thrombin. لما نجي low molecular weight heparin inactivates mainly factor X or factor 10. So this is predominantly factor 10 by low molecular weight heparin. بس هذا الفرق بينهم. Management of DVT and pulmonary embolism. So to prevent further clot formation, you can give low molecular weight heparin initially, or heparin, and this is immediately effective, but you do not usually use heparin long term. Long term, you are going to be using warfarin. And also no oral direct factor 10 and thrombin antagonist. هاي أكثر pharmacology منها biochemistry. Antiplatelet agents such as aspirin are not used for the treatment, but have some benefit in the prevention of recurrent DVT. How do you manage? Management with heparin or warfarin. Heparin is given in subcutaneous injection for 5 to 10 days until warfarin is achieved in the therapeutic INR of 2 to 3. فمشكلة warfarin إن لما تعطيه يحتاج تقريبا يوم، لا مو يوم، تقريبا 4 إلى 5 أيام عشان يوصل لي INR إلى 2 to 3. and this is the therapeutic range اللي إحنا نبغاه، لأن أي شيء ثاني will increase the risk of a thrombotic tendency. فإحنا ما نبي هالشيء، نبي 2 to 3 INR. فإحنا ننتظر لما INR يوصل to 2 to 3. فإيش نسوي إحنا على ما ننتظر؟ نعطيه heparin plus warfarin for the first 3 to 4 days until warfarin reaches an INR to 2 to 3. تبدأ تسوي discontinue لheparin. بس بالنسبة للheparin طبعا it is given to pregnant patients because warfarin is teratogenic, and you continue during and even postpartum for 6 weeks. بالنسبة للwarfarin you give it حسب the complication. The duration is determined حسب the complication. So uncomplicated provoked CAF DVT في مثال immobilized. إيش يعني provoked؟ Provoked يعني the patient doesn't have any inherited risk factors، ولا يعني it is يعني patient doesn't have any disease that predispose him to having DVT، فهو جاء كذا provoked. مثلا immobilized مثلا في الطيارة قاعد فترة طويلة. So this is called provoked CAF DVT. and uncomplicated تعطيه for 3 months warfarin. بالنسبة ل above knee DVT, pulmonary embolism and unprovoked is more serious because the patient has risk factors, has family history, has inherited disease that could predispose him to DVT. هنا تعطيه for 6 to 12 months. وindefinite تعطيه for life-threatening pulmonary embolism, cerebral or visceral thrombosis, recurrent, and even lupus anticoagulant. This is more pharmacology than biochemistry صراحة. بس what is heparin? It's a polymer of repeating tetrasaccharides that bind, activate antithrombin to inactivate factor 10 and thrombin, given subcutaneously or IV, used for prophylaxis of DVT and acute treatment. Safe for pregnancy. How is it reversed? Reversed by protamine. أما warfarin is reversed with vitamin K. Unfractioned heparin ولو molecular weight heparin. المهم هنا تعرف أن unfractioned heparin أو unfractionated heparin is short acting and reversible. أما low molecular weight heparin is longer acting and less reversible. And unfractionated heparin has a higher incidence of HITTS. وشو HITTS؟ طبعا we have side effects of heparin. One of the side effects is bleeding, and another side effect is the heparin-induced thrombocytopenia thrombosis. So this heparin-induced thrombocytopenia thrombosis, when you give heparin, some patients develop antibodies to heparin platelet factor 4 complex. For these actually activate the platelets and induce thrombosis with platelet consumption. So you activate the platelets, سبب لي thrombosis, there is a platelet consumption, فبيقل عدد الplatelets, thrombocytopenia. So these two things cause thrombocytopenia and thrombosis. So this is where it's called heparin-induced thrombocytopenia thrombosis. طبعا there's a risk of these thrombosis with an increase more than 50% drop in platelet count. Therefore, you have to monitor the platelet count when using heparin. Osteoporosis can also happen when using prolonged heparin administration. بالنسبة لwarfarin, inhibits the vitamin K dependent addition of the gamma carboxyglutamic acid to factors. As we said, 1972 for factor 10, factor 9, factor 7, factor 2. Also protein C, protein S. And this prevents the this used for prevention and treatment of arterial venous thrombus. As we said, it can be taken for 1 to 2 days to prolong this ratio, the prothrombin/INR, this ratio. Or 4 to 5 days it's taken for the therapeutic levels to be reached. So as we said before, it must be initially treated with heparin until warfarin is attained at stable therapeutic levels at 2 to 3 INR. هنا you discontinue the heparin. Reversible with vitamin K administration. It is هذا النقطة قلناها, and its clearance is determined by the degradation of cytochrome P450. So any inducer of cytochrome P450 will decrease the levels of warfarin, and any inhibitor of cytochrome P450 will increase the levels of warfarin. Require constant blood testing, monitoring of prothrombin, reported as the international normalized ratio اللي هو INR. قلنا therapeutic range انعادت علينا مليون مرة 2 to 3, so always keep it in this range. Because زي ما قلنا it is the lowest risk of recurrent thrombosis and the lowest risk of bleeding complications. طيب, the side effects قلنا as the level of INR increases, there is a risk of bleeding. So 10% bleeding, risk of serious bleeding with the increase of INR. 1% fatal bleeding, you treat it with prothrombin factor concentrate or reversible, يعني reverse it with vitamin K. Could also interact with multiple medications that either increase or decrease. We've mentioned this, teratogenicity, it's a teratogenic drug. Hemorrhagic skin necrosis can also happen when the initiation of therapy في البداية. Thromboprophylaxis, prevention of DVT and PE in high-risk patients, major orthopedic abdominal surgery. All of these, you can use thromboprophylaxis with patients hospitalized with comorbidities, chemo or mechanical thromboprophylaxis. You can use low molecular weight heparin, compression stockings or mechanical intermittent calf compressions. الدكتورة قراها بسرعة كلها هذه. Antiplatelet agents, these prevent the arterial thrombosis, unstable angina, post-AMI, and coronary stenting, TIA اللي هو transient ischemic attack, I think, and stroke prevention. هذه كلها given baby aspirin. وبعد شوي بنعرف baby aspirin. I'm sure we took it before. بس إنه we give it baby aspirin because of the selectivity of baby aspirin. Rather, when you give it a high dose aspirin, it's non-selective. So, aspirin pharmacology. نرجع لسنة ثانية. Aspirin inhibits COX, cyclooxygenase, COX-1 and COX-2 non-selectively when given in a normal dose. Baby aspirin اللي بنعرف احنا الحين ما نبي ندخل في pharmacology بس baby aspirin only inhibits platelet function. هذا اللي نبيه. It does not do any vasoconstriction, does not activate any platelet aggregation. So a baby aspirin or a low dose aspirin will only inhibit the platelet function, and this is what we are looking for when preventing recurrent DVT. So, باختصار, we want to inhibit COX-2, not COX-1 with aspirin. So what do? We give a low dose baby aspirin. Inhibition of COX-1 results to these things that احنا ما نبيها, and it is seen in aspirin toxicity. So inhibitors specific for COX-2, مثال على celecoxib, reduce these pathologic inflammatory processes while maintaining الأشياء اللي احنا نبيها or احنا ما نبي نسوي لها inhibit اللي هي physiologic functions of COX-1. So COX-2 we want to inhibit, COX-1 we want to keep. Baby aspirin or low dose aspirin helps us and does that for us. Aspirin clinical use, prevention of AMI, unstable angina, and reduces progression. And this is not effective for post-angioplasty or coronary stenting. وفي هذه الحالة we use a drug called clopidogrel اللي هو mentioned here. And these are the references, and thank you very much for listening. يعطيكم العافية.